Neuter County, more than 5,000 animals are euthanized every year simply because they are homeless. Our mission at Collier Spay Neuter Clinic is to provide high quality, high volume, affordable spay neuter services as a non-lethal solution to the current pet overpopulation crisis. Spaying and neutering prevents unwanted behaviors and certain health issues in pets. Pets that are spayed and neutered tend to be more well-behaved, focusing their attention instead on their families rather than in search of a mate. Spaying and neutering also cuts down on undesirable behaviors such as yowling in cats and urine spraying. For dogs, it can help to prevent the digging under the fence or mounting their human's legs, which can be embarrassing. Also, less of them roaming in the streets means less of them hit by cars.
Well, besides being important for them to spay and neuter for the health of their animal, with the obvious reasons being reduction of mastitis for the females, reduction of the occurrence of uterine cancer or ovarian cancer in the females and testicular cancer in the males, it's also important because we have a euthanasia rate in our country of more than 4 million animals per year. Unfortunately, it's looked at as a means of population control in the United States, and that's unacceptable in my opinion.
To succeed, we need to put more of our resources into preventing the animals from becoming homeless in the first place. Spay and neuter programs effectively reduce euthanasia rates and taxpayers' expense. Spaying and neutering cats and dogs is not just an animal welfare issue, it's a public safety issue. The pet overpopulation crisis is a direct result of pets left unaltered in our community. As long as we continue to allocate 95% of our resources into treating symptoms, we will never prevent the euthanasia of healthy, adoptable animals.
The National Spay and Neuter Response Team was founded in order to provide an opportunity for groups who have high euthanasia rates in their areas to find that alternative to using euthanasia as animal control by preventing the births before you have to euthanize. In order to do that, groups who have high euthanasia rates and high intake rates in their areas need a program that they can model after that provides them the opportunity to get high volume spay and neuter done in their area, and we created the program so that we could train groups how to do that appropriately, providing high quality, not sacrificing that, while still addressing the high intake numbers and the euthanasia rates in their community by providing the spay and neuter at a higher value.
Our staff, including myself, have been mentored and trained by the Humane Alliance model in Asheville, North Carolina. The Humane Alliance model is the most duplicated spay-neuter clinic model in the entire country, endorsed and supported by the ASPCA and PetSmart charities. Their goal is to strategically place 250 high-quality, high-volume clinics across the country. Our clinic is number 62. Once they have reached those 250 and those have been implemented across the country, together our coalition will effectively end pet overpopulation in the United States. Our veterinarians, every single member of our staff has our own individual mentor at Humane Alliance. Our staff trains there for 1 week, and then we have their training team here at our clinic for 2 weeks to guide us through the process of getting through our opening. After that, they continue their mentorship because in order for them to succeed, we must succeed.
Honestly, if we didn't provide high quality service, I wouldn't participate in it. My opinion is that every patient that we have come through should be treated as if it were your own patient, your own pet. Doing that allows for you to provide high quality. You're going to treat it as well as you do your own pet, and you know that it's going to get good care while it's in the individual's hands. We have an opportunity, or have had an opportunity, to participate in the guidelines established that were published in JAVMA in July of 2008, where 22 veterinarians came together from different specialties, boarded surgeons, boarded anesthesiologists, boarded internal medicine specialists, individuals who are out in the field providing high quality, high volume spay and neuter on a daily basis, and coming together to create what sets the standard of, high quality, high volume spay and neuter, so that you can provide these numbers of surgeries without sacrificing quality. So our program is designed to be committed to that level of guideline and make sure that those services are provided with quality always being the top priority.
I think that what is very different about us is that we are not compromising quality for efficiency. High quality techniques are crucial to the success of our mission and are very important to myself and all of the staff. Our clinic will provide services, only spay-neuter services. We have also partnered and collaborated with local area shelters, rescue groups, and feral cat caregivers. These are people who are providing for unsocialized cats out in the wild, trapping them, neutering them, and returning them. Our goal and vision is to break down all of the barriers that would prevent people from having their pets spayed or neutered. One of those issues is transportation for some people. And in order to address that, by partnering with local rescue groups, we have developed a transport system that will assist in the immediate future. Initially, we will be servicing Cape Coral as well as the Immokalee area. So our vehicle and transport driver will drive to these locations once a month, pick up the animals that are in need of our services, bring them to our clinic where they will stay overnight, and then our transport driver will return them the following morning. All members of the public, including the shelters and rescues, will also receive special incentives, such as if they bring in a litter, we will spay the mom for free. Once they have paid for 5 surgeries, we'll do the 6th surgery for free. And there are various other incentives that we will do as things progress, such as a $10 Tomcat neuter day.
It's incumbent upon anyone who owns a pet to have them spayed or neutered so that they have the opportunity to have a good, healthy, long life, and we're not euthanizing animals needlessly in shelters.
We cannot address the pet overpopulation problem in our community alone. We need a collaboration. We all have to work together to address this effectively.
At some point, we're going to reach that golden number that allows the shift to occur, the tipping point, so to speak, so that we're able to get enough of the animals spayed and neutered that we start to see that there is not a surplus any longer and that animals don't need to be euthanized, that we can find homes for them all, and it's more of a privilege to have a pet than a right.